Right. All right. So first I'll introduce myself. So I'm Tim Larson. I'm an electrophysiologist at Rush University in Chicago. The other people working with us today are our buzzer controller extraordinaire, Brian Clark, who's also a cardiologist here at Rush. And Letitia Anderson is our official scorekeeper. So hopefully we don't have to do too many corrections, but she'll have the official scoring if I mess it up. Let me go ahead and share my screen here so we can see the game board. And I have to get this black box out of the way. So this will give Alabama some time for their people to get here because I have to figure out how to get the black box that's covering the score to go away. Here we go. Okay. And can everybody see the score and all the questions without anything in the way?
Yes.
Yes, we can see that score.
Okay, so these are the score boxes. So team 1, that's University of South Alabama, you're green. Red is team 2, that's University of Alabama, Birmingham. Team 3 here, the blue team, is University of Colorado. Team 4, the purple team, is University of Connecticut. Team 5, this yellow box, is Yale. Team 6 is Maine Medical Center. And on the second row, the first one on the second row is, this blue one is University of Vermont. And this pink one is Dartmouth. So we can give another couple minutes and then we'll get started with the first question.
Yes, just give me a second. Okay, I think we can start.
All right, so our categories in this first single Jeopardy round are Do the Math, A Murmur by Any Other Name, Shocking, Ebb and Flow, and Born Forever. And the way we're going to start with just this $100 clue and do the math, and then after that, whoever answers correctly will control the board. So our first question under Do the Math for $100 is exercise-based stress testing is only deemed diagnostic at an adequate workload defined as achieving this percentage of the maximum predicted heart rate.
85%.
Well, so you have to wait. So you have to wait till Brian calls on you and tells you who buzzed in first.
Okay. I'm sorry.
So in this particular case, it is team number 3.
So team number 3. You get the first crack at answering this question?
What is 85%?
And that is correct. So 85% is correct. So team 3 has the points, and you now have control of the board. So please pick a category and a question.
Do 100. Shocking for 100.
All right, shocking for 100. So the hemodynamic profile below fits this type of shock. Central venous pressure of 17, pulmonary capillary wedge pressure of 19, systemic vascular resistance of 1,900, and cardiac index of 1.6.
Team number 4.
And team number 4, what's your answer?
What is cardiogenic shock?
And cardiogenic shock is correct. So 100 points for you. And you can see everybody can see the explanation, brief explanations on the answer slides as well. If you have any questions, let me know. But team number 4, you're now in control of the board.
$200 shocking.
All right, shocking for $200. The intra-aortic balloon pump tracing demonstrates
Team number 5.
all right, team number 5. What's your answer?
Balloon inflation.
Be more specific, please.
So the balloon is inflating before the dichrotic notch during ejection of blood from the LV.
With an open.
So that's correct. So that was team number 5, correct?
That's right.
Yeah.
So this is showing that it's opening too early. It should be opening after the dichrotic notch. That's correct. This is early inflation. Very good. And now team number 5 is in control of the board.
300 shocking.
Shocking 300.
Shocking for 300. Using the SCI cardiogenic shock classification, these hemodynamics are suggestive of classic stage C cardiogenic shock. Cardiac index less than 2.2, pulmonary capillary wedge pressure more than 15, cardiac power output less than 0.6, happy of what, and right atrial pressure ratio to pulmonary capillary wedge pressure of what. You have to get both numbers.
Great. So we have team 8.
So team,
Less than 1 and greater than 1?
that is not correct. That was shocking. Okay. Who's second next?
No other buzzes yet.
Anybody else? Otherwise, we'll move to the answer. All right. So the answer is PAPI of less than 1.85 and a right atrial pressure pulmonary capillary wedge pressure ratio greater than 0.8. So I believe that was team 5 that was in control of the board. So you get to pick again.
Shocking for 400.
All right, shocking for 400. 65-year-old man is admitted with chest pain and dyspnea. He suddenly becomes hypoxic, requiring intubation, and hypotensive, requiring vasopressors. Pulmonary artery catheter shows this tracing in the wedge position. His diagnosis is?
Team number 5.
Team 5.
What is acute mitral regurgitation?
Yep, that is correct. So it's acute severe mitral regurgitation, and in this clinical setting, most likely due to papillary muscle rupture due to MI. So, all right, so team number 5 still in control.
A murmur by any other name for 100?
Murmur by any, you said for 100?
Yes.
Okay. The classic auscultatory finding in atrial septal defect is?
Team number 1.
Fixed. What is fixed? Split S2.
And that is correct. Fixed split S2. And that was team number 1, correct?
Yes.
Yeah, so fixed split S2 is correct. So team number 1 is in control.
100 for Born Forever.
Okay, Born Forever for 100. The diagnosis is?
Team number 5.
What is anomalous origin of the right coronary artery?
And that was team number 5, correct? And that's correct. It's anomalous right coronary artery origin originating from the left coronary sinus. That's very good. And team 5 is in control.
Born Forever 200.
Born Forever 200. The congenital anomaly, or sorry, the congenital abnormality with a sword-like appearance as shown in this coronal maximum intensity projection image is
Team 7.
It's Setimer syndrome.
that scimitar syndrome is correct. Very good. And back to the board. That's team number 7 is in control.
400 or 300.
We'll do Born Forever for 300, please.
Born Forever for 300. The defect between mitral and septal tricuspid valves connecting the right atrium to the left ventricle is
Team 8.
What is
Gerbode defect?
8?
Gerbode defect is correct. Very good. Gerbode defect is the defect connecting the right atrium to the left ventricle. And team 8 is in control.
Ebb and flow for 400, please.
Ebb and flow for 400. LV outflow tract area by 3-dimensional TEE is 3 centimeters. LVOT velocity time index is 15. Aortic valve velocity time index is 50. Mean gradient across the aortic valve is 30. LV stroke volume is 25. Ejection fraction is 55%. Blood pressure is 120/80 millimeters of mercury. What is the diagnosis?
Team 3.
Is low flow, low gradient aortic stenosis.
Say it one more time.
Low flow, low gradient aortic stenosis, severe.
And it was at team 3.
Yes.
So that is incorrect.
So the next team is 2.
Team 2.
What is paradoxical low flow, low gradient aortic stenosis?
Exactly. Paradoxical is correct. So it's paradoxical because the ejection fraction was normal. Very good. And so now I believe that was team 2 is in control of the board.
Let's do Born Forever for 400.
All right. Born Forever. This syndrome is associated with TGFBR gene polymorphisms and carries an increased risk of abdominal aortic aneurysm and aortic dissection.
Team 3.
What is Marfan's?
That is incorrect. Do we have anybody else buzzed in?
That is Team 5.
Oh, man.
Team 5, what is your in?
What is Lewis-Dietz syndrome?
That is correct. Louis-Dietz syndrome is correct. Very good. And team 5 is now in control.
Ebb and flow for 100.
Ebb and flow for 100. A patient presents with a diastolic murmur. An echocardiogram reveals mitral stenosis with a deceleration time of 1500 milliseconds. The mitral valve area is,
Team 5.
and team 5,
What is 0.5 centimeters squared?
that is correct. And this is team 5. Okay. And here's the equation, or I believe 750 divided by the pressure halftime also gives you this answer. And team 5 is still in control.
Ebb and flow for 200.
Okay, ebb and flow for 200. The estimated regurgitant orifice area in this patient with mitral regurgitation. Pisa radius is 1 centimeter, aliasing velocity 40, MR jet peak velocity is 5.
Team 2.
Team 2,
What is 8? What is 8?
8 is incorrect.
0.8.
I'm sorry, one more time.
What is 0.08?
That is incorrect.
Next team is Team 5.
What is 0.5?
Team 5, yes, correct. It is 0.5. And here are the equation. Here are the equations listed here that got us there. 0.8 was close, but one step away. All right, team 5 is still in control.
Ebb and flow for 300.
Ebb and flow for 300. The diagnosis is, this is M mode echo.
Team 5.
Team 5.
Collapse of the posterior mitral valve reflex.
That is correct. Mitral valve prolapse. Very good. And team 5 still in control.
A murmur by any other name for 200.
Murmur for 200. This murmur is heard at the left upper sternal border, increases in severity with Valsalva maneuver.
Team 8.
LV outflow obstruction murmur.
That is correct. So this is a murmur of hypertrophic obstructive cardiomyopathy due to dynamic LV outflow tract obstruction. Very, very good. And team 8 is in control.
We'll do murmur by any other name for 300.
Murmur for 300. This eponymous murmur is a mid-diastolic, low-frequency rumbling murmur heard best at the apex with little radiation.
Team 8.
An
Team
Austin Flint murmur.
That is correct. Austin Flint murmur, which we hear due to aortic regurgitation, severe aortic regurgitation.
Murmur by any other name for 400.
All right, murmur for 400. This 5-year-old patient with cognitive delay and prominent forehead presents with a grade 2 to 3/6 crescendo decrescendo systolic murmur heard at the right upper sternal border with radiations to the carotids. Her diagnosis is?
Team 4.
Team 4.
What is Sean syndrome?
That is not what I have.
Team 1.
What is Williams syndrome?
Williams. So Williams. What team was that?
Team 1.
Team 1. That is correct. So Williams. So supravalvular aortic stenosis, and the described patient has in fact Williams syndrome. So very, very good. And team 1, I believe, is in control.
Which one? 200, please.
Okay, do the math for 200. Blood pressure is defined as the product of the cardiac output times this value.
Team 1.
What is SVR?
SVR is correct. Very good. And back to the board, team 1.
What 300, please?
So do the math for 300. So pulmonary artery pulsatility index, PAPI, is defined as the pulmonary artery systolic pressure minus the pulmonary artery diastolic pressure divided by what?
Team 2.
Team 2.
What is cardiac output?
I heard cardiac output. Is that what you said?
Yes.
That is incorrect.
Team 5.
What is right atrial pressure?
Yes, right atrial pressure is correct for team 5. Here's the equation in red lettering. Or central venous pressure would also be acceptable. So our last question here with team 5 in control is our daily double. So team 5, what is your wager? You can wager up to $2,000.
400.
So $400, and again, team 5 is the only team that is eligible to answer this question, but there's $400. So do the math. This is the estimated pulmonary artery systolic pressure. Assume a CVP of 10 based on the figure below. And start the timer and please give us your answer. Team 5.
Is 74 millimeters of mercury, assuming that the TR pressure is 4 maximum.
Yes, so 74 is correct. Very, very good. based on the peak tricuspid regurgitant velocity shown here. So very good. So that's the end of the single Jeopardy round. Right now, team 5, which is Yale, is leading with $2,400, followed by team 1, which is University of South Alabama, and then team 8 is Dartmouth and Vermont, then UAB, Connecticut, then Colorado. So, and I think Maine's in the middle there. What was that?
Are our buzzes coming through at all?
Which team is that?
Maine. Yeah, we've just
6.
we're not.
Yeah, I've been seeing I have been seeing everybody's buzzers coming through. It's
All
just the timing.
All right, so I think we're gonna take a 5-minute break now, and I think Brian has. Does Brian need to share his screen or?
Yeah, I believe so. Let me see.
Great job, everybody.
Don't worry.
How do I pause share? Okay.
Yeah.
Are you able to take over now, Brian?
It still looks like it's saying I can't share it while you are still sharing, I believe.
Let me try this. Okay, how about now?
Let's see. Yep. I can share it now. Give me 1 second. Can you all see my screen?
Okay, so I'm gonna start a 5-minute timer also for a break.
Okay. All right, so what we're gonna do now is do an audience question, and it will be for a $30 Amazon gift card. So I'll present the question, and then the audience members should submit their answers to the chat box to me directly with their answers, and whoever is able to get it correct will get this Amazon gift card. So hold tight.
It was Eastern time. That's why I did not realize that.
Okay. Can everybody see the PowerPoint? Tim, can you see it?
Yes, we can see it.
Who are we submitting the answer to?
To me in a private message. Well, it's only for the audience, not for the team who are participating. All right. Okay, here we go with the question. So this number in the loop below represents aortic valve closure. Right, so the answer here is 3. And the correct answer that came in first was from Marnie Welsh. So congratulations. We'll be in contact with you about getting the gift card for Amazon. All right, so I'm going to stop sharing my screen so you can tape back over to Tim.
All right, so let me get the PowerPoint backed up. And yep, this is us. So we'll give it another couple minutes. There's still a couple more minutes on the break, but when we're done, we'll make sure everyone's back and we'll go on to the final. All right, so I think it looks like we have everybody. Brian, are you ready? And
yep, I'm ready. So is it okay if we test everybody's buzzer one more time? A couple of folks just wanted to make sure their buzzers were working, so we can, I'll open up the buzzing and give everybody an opportunity to test out just to make sure. Okay, so it'll be open in 3, 2, 1. Okay, so I have 1, 2, 3, 4, 5, 6, 7, 8. So everybody's buzzer is working.
Okay. Well, if everybody's ready, let's move on to the double Jeopardy round. So our categories for double Jeopardy are life in the fast lane, cardiomyopathies, it's complicated, under pressure, and life in the slow lane. So I believe Yale had control last round and has the highest score. So Team 5, if you could get us started, that'd be great.
We'll take life in the slow lane for 200.
So life in the slow lane for 200. The most common site of conduction block for Mobitz 1 Wenckebach block is?
Team 4.
What is the AV node?
And AV node is correct. Team 4, very good. Again, the Mobitz 1, the block is typically in the AV node. Mobitz 2 is infranodal block. So Team 4 has control of the board.
We'll do life in the slow lane for 400.
Life in the slow lane for 400. The next step in management of this 56-year-old asymptomatic male with the ECG below while he is lying, this occurs while he's lying in bed. A is beta blockers, B, walk the patient, C, pacemaker implant, or D, reassurance.
Team 6.
What is B, walk the patient?
Team 6, that is correct. That was Team 6, correct?
Mm-hmm.
Exactly. So what we had was 2-to-1 AV blocks. So if he's at rest, this could be either Mobitz 1 or Mobitz 2. And of the answers given, the best way to delineate is to stimulate the patient, walk them or exercise them and whatnot. Mobitz 1 gets better. Mobitz 2 stays the same or gets worse. Very good. Team 6 has control.
Life in the slow lane for 600.
Life in the slow lane 600. The etiology of this pause that is exactly equal to 3 sinus intervals.
Team 3.
What is a vagal response?
That vagal response is incorrect.
Team 1 is next.
What is SA exit type 2 block?
Yeah, SA exit block is correct. Very good. Sino-atrial exit block. So the key to this is that it's a sinus pause. There's no P waves, and it's an exact multiple of the baseline sinus cycle length. Very good. Team 1 is in control.
Under pressure. Under pressure 200, please.
Under pressure for 200. Name 2 blood pressure lowering medications that are acceptable for use during pregnancy in a woman with hypertension. Medications that have a class 1 recommendation.
Team 2.
What are labetalol and hydralazine?
That is incorrect. What team? That was Team 2?
Yep.
That is incorrect.
Team 4.
It's methyldopa and labetalol.
Labetalol and alpha methyl dopa, that is correct. That was Team 4. And then nifedipine is also acceptable, but you only had to get 2 out of 3 possibilities. So Team 4, you have control of the board.
We'll go with life in the slow lane for 800.
All right, life in the slow lane for 800, and we have our daily double. So this is Team 4. So you have $100, but you can wager up a maximum of 800.
Okay, yeah, we'll wager 800.
So for $800, and again, Team 4 is the only team answering this question. The treatment for phase 4 AV block or paroxysmal AV block is
What is a pacemaker?
And that is correct. Very good. So pacemaker. So phase 4 AV block, which is block following a premature beat, usually a PAC or PVC, and only resolves after another ectopic beat. So this is life-threatening and a pacemaker is indicated. Importantly, and this shows up on the board sometimes, is this should not be confused for a vagally mediated AV block. So even if it occurs at night, phase 4 AV block needs pacemaker is indicated every time. So very good. So team 4, you're in control.
Life in the fast lane for 200.
All right, life in the fast lane for 200. The rhythm demonstrated in this tracing is?
Team 4.
What is a typical atrial flutter?
Yes, typical atrial flutter is correct. You can see 2-to-1 conduction, and you can see, I hope you can appreciate the continuous sawtooth pattern. So team 4, still in control.
Life in the fast lane for 400.
Life in the fast lane for 400. So a 76-year-old male with COPD is admitted with acute pneumonia. The ECG diagnosis is?
Team 4.
What is multifocal atrial tachycardia?
And that is correct. Very good. You can see 3 or more distinct P wave abnormalities with a rate over 100 beats per minute. And this typically occurs in hospitalized elderly patients with lung disease who are coming in with acute worsening of their lung disease. Very good. And team 4.
We'll go with life in the fast lane for 600.
Life in the fast lane for 600. It looks like we have another daily double. So this is team 4. So you have $1,500, so you can wager up to $1,500.
We'll wager 600.
Okay, 600. And there's that. And so this is for team 4. The rhythm in this 32-year-old male with syncope is?
Atrial fibrillation with WPW.
Correct. This is very good. So pre-excited atrial fibrillation. You can see very irregular, and you see varying degrees of pre-excitation, including some non-pre-excited beats, which is the giveaway in this tracing. So very good. So next question.
We'll do life in the fast lane for 800.
Life in the fast lane for 800. The tachyarrhythmia shown in this ECG is?
Team 4.
Team 4.
Long RP tachycardia.
So you, that is not correct.
Team 6.
What is atrial tachycardia?
That is also not correct.
Team 2.
What is ectopic atrial tachycardia?
Team 2, that is incorrect. So this was a tough one, but so that was 3. So I'll give you the answer now. So this is a junctional tachycardia. So I think you guys can see the P waves preceding the QRS, which is probably what threw you off. But the key here is that the PR interval is very short. It's less than 110 beats per minute, and the P waves are this inferior axis, consistent with coming from the junction, inferior left axis. So the correct answer for this one is junctional tachycardia.
Like that, but there's two ways.
So who was in control? I think it was team 4.
All right, so we'll go with under pressure 400.
Under pressure for 400. ACC guidelines recommend initiation of blood pressure lowering medications for primary prevention of cardiovascular disease in adults without cardiovascular disease and with an estimated 10-year atherosclerotic cardiovascular disease risk score less than 10% if the average blood pressure is above what?
Team 5.
What is 140 over 90?
140 over 90 is correct. Very good. And now team 5 is in control.
We'll stick with under pressure for 600.
Under pressure for 600. Resistant hypertension, hypokalemia, and metabolic alkalosis in a 40-year-old female should prompt evaluation for
Team 4.
Team
What
4.
What is primary?
Primary aldosteronism.
Yes, primary hyperaldosteronism is correct, or also known as Conn syndrome. Very good. So Team 4 has control of the board.
Under pressure 800.
Under pressure for 800, the preferred antihypertensive agents in patients with hypertension and thoracic aortic disease are
Team 3.
Team 3.
What is beta blockers?
Beta blockers are correct. Very good. It's a class 1A indication. Very good. Team 3 is in control of the board.
Cardiomyopathies for 800.
Cardiomyopathies for 800. The cumulative lifetime dose of anthracycline chemotherapeutics, such as doxorubicin and daunorubicin, that has been identified as a risk factor for chemotherapy-induced cardiomyopathy is?
Team 4.
What is greater than 450?
That is incorrect.
Team 5. What is 550 milligrams per meter squared?
Team 5, that is correct. 550 is the milligrams per meter squared is correct. Very good. Team 5, you're in control.
Cardiomyopathies for 200.
Cardiomyopathies for 200. A 26-year-old male presents to your clinic with syncope. His ECG shows T-wave inversions in V1 through V4 and frequent PVCs with a left bundle branch block pattern, left inferior axis. The following diagnostic tests should be ordered to further evaluate his PVCs.
Team 4.
What is the exercise test?
Exercise stress test is not correct.
Team 6.
What is that, cardiac MRI?
Cardiac MRI is correct. So there's several possibilities here. So what the STEM is giving you gives you several of the diagnostic findings in ARVD. So imaging is generally the next step, either transthoracic echo or cardiac MR. By the guidelines, you could also consider signal average ECG or ambulatory Holter monitor. But all right, so team 6, I believe, is in control.
Let's do cardiomyopathies for 400, please.
Cardiomyopathies for 400. The diagnosis demonstrated in this echocardiogram image is, and this is an LV apical 2 view.
Team 1.
Team 1.
What is LV non-compaction?
That is correct. LV non-compaction. So the ratio of compacted layer to non-compacted layer to compacted layer is greater than 2. So that's diagnostic of LV non-compaction. Very good. And team 1 is in control of the board.
600 for cardiomyopathy.
All right, cardiomyopathies for 600. So for patients with hypertrophic cardiomyopathy with no change in clinical status or events, echo should be repeated every what?
Team 5. What is every 1 to 2 years?
Team 5, every 1 to 2 years is correct. Very good. That's straight out of the guidelines, class 1 indication. So I see we've kept the complicated category for last. So team 5, where would you like to start?
Okay, it's complicated for 200.
All right, it's complicated for 200. So the optimal timing for ACE inhibitor and beta blocker therapy initiation in patients post-STEMI with EF less than 40% is, and you have options, 7 days, 1 month, as soon as hemodynamically stable, or ACE inhibitors are contraindicated immediately post-MI.
Team 4.
As soon as hemodynamically stable.
That is correct. That was team 4, correct?
Mhm.
Yeah.
All right. As soon as hemodynamically stable. So team 4 is in control.
We'll do 400. It's complicated.
It's complicated for 400. A 70-year-old male presents to the emergency room with sudden onset severe dyspnea and syncope 5 days after right coronary artery STEMI. Blood pressure is 70/40. A bedside echo shows severe mitral regurgitation. The most appropriate treatment is
Team 4.
Surgery for ruptured papillary muscle.
correct. Emergency surgery for and you're correct that this is papillary muscle rupture. Very good. Team 4, which question?
600. It's complicated.
It's complicated for 600. The usual location of conduction block in patients with inferior wall STEMI complicated by complete heart block is the His bundle, AV node, the myocardium itself, or the left posterior fascicle.
Team 2.
What is the AV node?
That is correct. So team 2, that was team 2, correct?
Yep, yes.
So with inferior MI, the site of block is usually the AV node and usually recovers, as opposed to anterior MI, the site of block is generally infranodal and does not typically recover. Very good. And so the last question is, it's complicated for 800. A 70-year-old female presents with 5 days of chest pressure. ECG shows anterior wall STEMI with Q waves in V1 through V4. Echocardiogram shows apical and anterior wall aneurysm, moderate mitral regurgitation, and systolic anterior motion of the mitral valve. Blood pressure is 70/30. While preparing for angiography, this is the ideal pressure. This is the ideal pressor.
Team 5.
What is phenylephrine?
That is correct. It's phenylephrine is correct. And this patient has evidence for LV outflow tract obstruction due to late presentation of an anterior wall STEMI. So phenylephrine will help with that obstruction, whereas other pressors that are positive chronotropes can actually make it worse. So very, very good. Everybody did very good. So that concludes the double Jeopardy round. So for final Jeopardy, let's see, in the lead is team 5 with 5,000, followed by team 1 with 1,700, then team 4, 1,500, and team 8, 500, and team 7, 200. And then the 3 teams with negative scores right now are not able to participate in the final Jeopardy. So let me open up the final Jeopardy. So the clue, the category is ECG localization. So now the 5 teams that are in the have positive scores, you need to send me a chat message. Make sure you send it directly to me with your wager. So you can do that right now with the category being ECG localization. And you can wager up to the amount that you have. See if let me make sure I have everybody's wager. Okay, I have everybody's wager. So you're gonna answer, when you answer, it'll be the same. So you'll have to direct message me the answer to make sure that you don't send it to everybody in the chat. So I'm going to reveal the question, and then when the music plays, you have until the time that the music stops, I think it's 30 seconds, to submit your answer the same way by chat. So here is question, the etiology of sudden onset crushing chest pain in this 68-year-old smoker with hypertension and diabetes. And here is the EKG. Okay. And let me make sure I have everybody here. Let me just make sure I have answers from everybody. Okay, it looks like I have all the answers, so great. So now, let me go back to the final Jeopardy scoring page. And I have to just enter your wagers in here 1 second. To hide this, apologize. Okay, so let me show the answer here, and so the answer is posterior STEMI, and what we have here is an ECG with leads, with posterior leads, and you can see the ST elevation in the posterior leads. So if we go through, so let's start with the lowest score. That was team 7. They had 200. They got it correct and wagered 200. So their final score is 400. Next is team 8. They got it correct also, but did not wager anything. So they stay at 500. Next we have team 4, who also got it correct, and they wagered 1,000. So they're up to 2,500. Team 1, they got it correct as well. They wagered 200, so their final score is 1,900. And lastly is team 5, who also got it correct, but did not wager anything. So they finish at 5,000 points. So very good. You guys all did great, and I hope you enjoyed it. But it looks like our winner today is team 5, which is Yale. So congratulations.
Thanks. How do we get the 5,000?
You have to talk to the ACC.
That is a very important question. Thank you for asking. But you do get to go, Yale, you get to go to ACC 21. So we will send, congratulations, we will send your names to ACC 21 for the Jeopardy. You'll be representing Connecticut. University of South Alabama, despite all the technical issues with getting your team, you will be representing the state of Alabama at ACC 21. Congratulations, South Alabama. Colorado, you get a free card to ACC 21, so you'll be going to ACC 21 as well. Thank you for playing. I hope this was good practice for you as well. And the Northern New England chapters of Maine, Vermont, and New Hampshire. Dartmouth is the winner of your 3-team competition. And so Dartmouth, congratulations. We will be sending your team names to ACC 21. Just so you all know, it will be a virtual competition as well at ACC 21. So I hope this was a good practice for you. Congratulations, everyone, for participating.
Thank you for your help in organizing this. We appreciate it. Have a good day.
Thank you.
Thank you, everyone. Thank you.
Good job. Good job.
Congratulations, everybody.